I grew up in a small community. It's about 56 proper citizens that live in the community, but it is a farming community. My father was a miller, and he and his brother operated a feed and grain elevator and a mill. My mother was a nurse, and as long as I can remember, I wanted to follow in her footsteps. I have 4 sisters and 1 brother, so there are 6 of us all together. My older sister is Pat, and then my brother is a year younger than I am. His name is Alex. And then Mary is living out west, and Ruth is an engineer in Chatham. And then the baby of the family is Christine, and she also works in Chatham at a seniors residence. When I grew up, it was at a time for girls. They could either be teachers or they could be nurses. I always wanted to go to Public General Hospital, even though when I graduated high school, I did apply to other nursing schools and visited other nursing schools. But the draw to Public General Hospital was simply because that's where my mother graduated. It was a 2-year program. I had no idea at the time that the Ministry of Health were going to make a change in terms of nursing schools. Hospitals would no longer have nursing schools. And so they transitioned them all right in the middle of my education to the colleges. But that transition was virtually seamless. And what I know now about change management, they did a fabulous job. It was just incredible how they made that transition. In '74, when I graduated from nursing, jobs were fairly plenty in nursing, and it was fairly easy to get a job. And there was no question I was going to work at the hospital that I trained at. It was never a question of leaving town. I received a job on the inpatient surgical unit, so as soon as I finished my nursing diploma exams, my registration exams, I started working on the inpatient surgical unit. And at the time, my vision was to work a couple of years, start a family, and then raise my family. But it wasn't very long before I realized what a rewarding career that nursing was, and I stayed. And I got involved, and I would say engaged, in my workplace and my work environment. And without knowing it, I started to be drawn into changes. In the late 80s, I had an opportunity to step into my first real leadership position as an infection control practitioner. In about 1989, excuse me, the vice president of the hospital came down to see me and said, I think you have some leadership potential, and I would like to invite you to take the leadership position of materials management. I eventually made the decision to move down into that position, and it was a huge learning curve. It was, again, several years of transition and change. Midway through, the restructuring commission came along for hospitals and healthcare systems. We merged with another hospital. I took the leadership position for the 2 hospitals and merged inventories and brought staff together and created a unified staff. And throughout that period of time, I was both continually learning, but not just informally, but formally as well. I had an interest in the change and the organizational development and transitions within organizations, and that's what drew me into the business world and the business degree. So I applied to the University of Windsor and started taking courses located at the St. Clair College in Chatham and towards a business degree. After the first 2 years, the courses were no longer available at St. Clair College, so when you get to year 3, you then start driving 401 to Windsor. And one day a week soon became 2 days a week, and I graduated in 1997 with an honors Bachelor of Commerce degree. Rolled right into an MBA. After I finished my MBA, I continued to work in materials management and facilities. I did see, though, that I wanted to advance my career. I wanted to take it to the next step, and I wasn't going to be able to do that in the materials management facilities role. So I challenged the system in 2000, 2001 and went back after almost 10 years in the corporate side, as we called it, and I applied for a position back to clinical leadership. In doing that, I became the director of the medical program. Late 2005, I got a call from a vice president. That vice president who had asked me to step into materials management was now in Sarnia as the CEO. And he said to me, "Are you ready for your next challenge?" And I said, "Yes, I am ready for my next challenge." And he said, "Consider VP of Corporate Services position." And I interviewed for that position with that CEO and was successful in getting that job here. After a year, there were more changes. The board asked me to take the interim CEO position. I never wanted to be a CEO. I had my dream job as the vice president. That was my dream job. It took about 8 months, and they were still recruiting. And the recruiter talked me into throwing my name into the ring. The board took their time, and it was probably another month and a half, 2 months before the second round of interviews, and before they were ready to do that second round of interviews. And by then, I said, we've made a lot of progress in our organization, and I am not going to hand this over to somebody else. So March 30th, 2008, the board announced that I was a successful candidate as the CEO. When I came in 2006, this organization had been planning a new hospital or a significant expansion to one of the hospital sites. In 2010, we moved all of our, most of our clinical services, all of our acute care services, and most of our clinical services into this brand new construction. Here at Blue Water Health, we have about 1,800 staff, physicians, and volunteers. We have almost 200 credentialed physicians, full MRI suite, and so we offer the full range of diagnostic services for patients, both in laboratory and in diagnostic imaging areas. I married my husband Ron in 1996, and he has been a great support for me. My daughter Angela went to the University of Waterloo and became a chartered accountant, worked at Price Waterhouse for a few years in Windsor, and is now working at Union Gas in Chatham. So I get to see her and 2 grandchildren, Haley, who is 6, and Nolan, who is 2. My son Timothy went to University of Laurier, so both my children were attracted to Waterloo for some reason. And he didn't come home. He stayed in Waterloo, and he works for the RBC as a financial planner. It's a very rewarding career to help patients and to see patients in their most vulnerable periods of time and to help them and see them through to wellness or healing and to home again. And you're much more likely to get that exposure and that introduction through your local colleges, such as St. Clair College.